Hi, I'm Dr. Sam Mann, and this is Beyond Conventional Medical Thinking. And this is the beginning of a two-part podcast, the title of which is A Radical New Mind-Body Understanding. And there's been a lot written about the mind-body connection, and I'm confident you'll find this very interesting and important and pioneering. So let's get started. Thousands of studies have examined the mind-body connection with related to medical illnesses. And this has been going on for decades, tremendous interest in it. And I'm going to start this discussion with the topic of hypertension for a few reasons. First of all, there's been more mind-body research in hypertension than in any other medical condition. Hypertension has long been considered the medical condition most likely to have a mind-body component as a cause. And third, of course, is because it's my specialty, so I know more about it than so many other conditions. So, is there a mind-body connection in hypertension? And the answer is yes, there is, but it's very different from what almost everyone thinks. It's an understanding that's almost non-existent in the medical literature. What's important also is this is relevant to a number of other chronic medical conditions whose origin and whose treatment still challenge us. So, for example, chronic fatigue syndrome, migraine, and others. And it's important because chronic fatigue syndrome, to this day, we don't know the cause or have effective treatment for it, and it's disabling to so many. And we'll get into that. That'll be a third podcast focusing on that. So I'm going to present this understanding, which I learned over decades of experience with patients. My patients taught me. And I'm also going to present evidence, published evidence, that supports this understanding. And again, it's somewhat counterintuitive. And again, it did not require any technology to acquire, and yet nobody really offered this understanding. I think it's pioneering. I ask you to please forward these podcasts to others and help introduce a truly groundbreaking understanding of the mind-body connection, that it's relevant to the medical conditions of millions of people. So, starting with hypertension. Common belief was that emotional distress led to the development of hypertension, and relaxation techniques and stress reduction techniques could relieve the condition. And there were hundreds and hundreds of studies reported and published, and they focused on emotions such as anger and anxiety and its relationship to hypertension. And a lot of studies reported a positive relationship. So then why am I questioning it? Well, first of all, there were also other studies that did not find that relationship. And many studies also reported that relaxation techniques could lower blood pressure, but many others did not. And so, to sum it up without spending too much time on it, a meta-analysis by Jorgensen of hundreds of studies, and it showed that there was no relationship. And similarly, studies of relaxation techniques and biofeedback also showed minimal drop in blood pressure. So the final nail in the coffin is that it has led nowhere in understanding or treating hypertension. So why did everybody think there was a relationship? If we're going to discard it, what about those studies that showed it? Why did everybody think there was? Well, first of all, anger and anxiety, emotions such as that, do raise our blood pressure in the moment in anybody. And calming down lowers our blood pressure. Nobody would dispute that. But does that mean that it translates to a sustained elevation in blood pressure in people who tend to get angry or anxious? And they couldn't prove it, that it causes persisting hypertension. Another factor that misled us: a lot of people are anxious at their doctor's office, and their pressure is higher at the doctor's office. It's higher when they're participating in studies and the blood pressure measurement is at the doctor's office. And that also misguided because it showed a big difference with placebo effect or what other. But the key thing is the development of the 24-hour ambulatory blood pressure measurement, where instead of relying on the blood pressure in the office, 24-hour assessment of blood pressure. And that's where the studies began to show much less effect of emotion on our blood pressure over the course of 24 hours. A study performed in France, which was a nice study, looked at emotional strain, job stress, and blood pressure monitored 24 hours, and then 5-year follow-up found absolutely no difference. We spend a lot of our time at work. What about job stress? And this was a study that I published that looked at the studies that assessed the effect of job stress on blood pressure. And what the studies showed is that if you looked at the studies that just measured office blood pressure, there was a relationship, and 60% showed that job stress and hypertension had a relationship. But if you look instead at the studies that used ambulatory blood pressure, there was much less. And the relationship was even less when you looked at those in whom the relationship was found in overall in the study total population as opposed to a subgroup. And I'll get to that in a minute. So the problem is, why did everybody think there was? And there were a few key factors there. For one, research psychologists believed it strongly, and they were biased. They wanted to have a positive result because they strongly believed it. Also, getting future grants depended on getting some positive results, also increased the chance that bias affected what they reported and published. Many other studies showed no relationship. And again, the manipulation of data to tease out a relationship was present in a number of the publications. Another problem, subgroup analyses. So they would do a study. Overall, there was no relationship. But if you look at subgroups, they could find a relationship in women, but not in men, or in men, but not in women, even though overall there was no relationship. And those were published as positive studies. Another means of affecting the results is there'd be several parameters of emotional factors, and they could take a measurement of all, let's say 7, and in 5 or 6 there was no relationship, but in 1 or 2 there were. And those 1 or 2 would end up as the focus, proving the point in a publication. So those are all reasons why there was an exaggeration of the positivity of the research that was done. So at this point, after decades of that research, the belief that there's a mind-body relationship that drives hypertension has shrunk and is virtually dead. So then, is there a mind-body relationship or isn't there? What am I talking about? And my answer is, I think there is, but it is very different from what everybody assumes, very different from what's been published in the literature. And let me explain further. When we look for a cause of hypertension, medically speaking, there are 3 main mechanisms that drive hypertension. And in most patients, it's driven by one of the 3 or 2 of the 3, or in some patients, even all 3. And it could be the first mechanism or the third or any combination. And in most patients, it's driven by the first 2 mechanisms, which are related to kidney functions. And it's related in many to sodium, salt, sodium intake, and also the genetic tendency to hold on to sodium. And the renin-angiotensin system, which is also, renin is an enzyme produced by the kidneys, and it stimulates an increase in blood pressure. And Ironically, I mean, when you think about hypertension and disease and evolution, this is not a case in where evolution got it wrong. Evolution got it right. So, for example, in areas where there's a hot climate over the centuries, the biggest problem was people could dehydrate from sweating, and the natural diet they had, they didn't have salt shakers, depended on their ability to hold on to sodium, to hold on to salt and not excrete it excessively in the urine. Now you take somebody who's got those genes, and by the way, evolution is not concerned about do we make it to 60 or 70. Evolution just wants to get us to 40 or 50 maybe. When you put somebody in a climate where it's not as hot and where there's a ton of salt intake and the salt intake is higher, that person genetically is holding on to so much of that sodium, and that raises blood pressure. And that's why in many patients, a diuretic is a wonderful medication to lower blood pressure. So the genetics, evolution had it right, but the conditions are different. Um, Ironically, also, genetically, we are programmed to survive famine. There has been famine for centuries, and people who can survive on fewer calories are more likely to survive famine throughout history. And what do we call those life-saving genes that help us survive famine? We call them today obesity genes, because those are the people who tend to gain weight, not because they're eating so much more than everybody else, but because their body needs fewer calories genetically. So it's interesting. So those two mechanisms drive hypertension in a majority of patients, and it has nothing to do with the mind-body connection. In some people, there's an indirect connection in that if somebody has a lot of stress and it makes them eat a lot and gain weight and drink and smoke, that can affect the blood pressure. But per se, it is not a mind-body disorder directly. In those patients, as I said, the diuretics and the calcium channel blockers will help control pressure, those where it's sodium volume related, and the ACE inhibitors and ARBs for those that are renin related, and they work in most patients. So then where are we going from there? What about the third mechanism? The third mechanism is the sympathetic nervous system, our fight or flight reflex, which has a lot to do with emotions. You get excited, your pressure goes up, heart rate can increase, blood pressure can increase. So if there is a mind-body connection, it's related to probably to the sympathetic nervous system, and in patients where the hypertension is driven by the sympathetic nervous system. But then there's another mystery. We just said how decades of research failed to show that emotions caused hypertension. So we have to come up with a different understanding. And what is the origin of the increase in sympathetic tone? There are hypotheses recently about inflammation, about genetics, but overall, you ask any physician or researcher, what is it that drives the sympathetic nervous system? Usually, it's not clear. Well, are there any clues in a patient that it could be driven by the sympathetic nervous system? And yes, there are clues. Certain types of hypertension, studies show, are associated with an increase in sympathetic nervous system tone. We can't measure sympathetic tone in the doctor's office because there are no clinically convenient methods, but there are methods that are used in research when they find certain types of hypertension are associated with an increase in sympathetic tone. And it's not the patients with ordinary run-of-the-mill hypertension. Somebody's a little overweight, they're 50 years old, they have family history of hypertension. That's not a mystery. But we're talking about less usual types of hypertension. So, for example, a young patient, a thin 25-year-old, shouldn't have hypertension. We always look for medical causes. We find a cause in 10%. Most of the others, we don't know the cause. Severe hypertension, it's not a common thing. People who have severe hypertension, there's often a reason, but we don't know what it is. We do the workup. 90% of the time, we don't find a cause. Resistant hypertension. We define resistant hypertension as somebody whose hypertension is not controlled by medications that target the two kidney mechanisms, either or both, doesn't control. That's resistant hypertension. You have to think of the sympathetic nervous system. And in fact, studies show there is increased sympathetic tone in patients with resistant hypertension. And finally, a very uncommon cause of hypertension, for a type of hypertension, paroxysmal hypertension, people who get sudden episodes out of nowhere, sky high pressure lasting for hours, headaches and symptoms. It had been a mystery for decades what caused it or how to treat it. And I will talk about that in the second part of this second podcast on this topic, where this understanding pioneered the only explanation and treatment approach for that disorder. So those are the conditions, types of hypertension. And again, what is the cause in those patients? And I noticed something that suggested to me a mind-body origin, something, connection that it's different from what everybody thinks it is. It's a connection that has almost never occurred to most people and researchers, or to doctors, or to patients. And more important, this understanding opens the door to effective treatment, to pay more attention to medications that target the sympathetic nervous system, other medications, and also the opportunity for emotional healing that can result in resolution of the hypertension. But nobody's aware of this. So that's what my Mind Body podcasts are about. And we're going to dive into that in part two, the next podcast, of what is the cause, how did it come to my attention, and what is its relevance to treatment of hypertension, and also potentially to a number of other common medical conditions that to this day we still don't understand or treat well. I will also present some of the evidence that backs up this understanding. And again, I'll emphasize in those conditions, I am not stating it is the cause in every patient with those conditions, although in the chronic fatigue syndrome, I think it is a large majority in whom it is relevant. It is so crucial. And we'll be getting into that. Again, my book, Hidden Within Us, is available on Amazon, which discusses this new mind-body connection. And please let others know about these podcasts because this is truly pioneering thinking. And I will clarify that new process of understanding in part two, the next podcast in 2 weeks. Thank you for your attention and looking forward to continuing on this topic.